Do you think government schemes indirectly lower the standard of cancer?
Yeah, so this is, I really wanted to answer this. The government has been working very actively, not just the NDA government, but the UPA too also in their second term, to increase the level of cancer care given at governmental institution, at tertiary care hospitals. I'm not sure how much they know of the level of work and research which is being put out by the Tata Memorial.
Yeah.
The government is making the National Cancer Institute at Jhajjar, which was about to commence. It was inaugurated last year and was good step of operations, but obviously all this COVID-19 has delayed things by a bit. And there is a national cancer grade, which is being made operational as we speak. So all the centers administering cancer care have to be on the NCG, and which has an integrated software where data capture is essentially automatic, so that we will get more accurate information about what are the cancers. Private hospitals have been told to fall in line and be part of the NCG, otherwise they will not be given license for radiation therapy, which is an integral part of cancer treatment. So things are happening. It's very easy to say our government decisions are bad, whichever party is in power. But on the whole, I think this person needs to understand that India is in a very delicate position where we're dealing with not only non-communicable diseases such as cancer, diabetes, heart disease, but we're already embattled and have been stuck with infectious diseases for such a long time. So, I mean, there's 16,000 deaths a day in the country from tuberculosis, even today. So, you know, you've got both the burdens. The West has gone in a tailspin when it's faced with one infectious disease in a long time in the form of COVID-19. Can you imagine India's battling on both fronts? So you really don't know. Yes, what the government could do is increase its spending on healthcare and education.
Yes.
Both, but because as we see, if one is to believe the conspiracy theories that this is a biological warfare, well, then World War III has been fought without a single bullet being fired. And, you know, so when we're getting Apache helicopters and, you know, this and that, and for trillions of dollars. So you got to think of it. The government is moving as best as it can, but with the constraints. But, you know, planning for 1.3 billion people isn't easy. And I think somebody said that, made this question, said, because of the government stance, certain trials and drugs are not approved or available in this country for free. Well, very little is, because you have to understand patent laws. And when a drug is on patent, there's nothing any government can do to pick it up and subsidize it. Even when they buy it from the company or the distributors for that company, it's still at wholesale price, which is a fairly significant amount in itself. As far as generics are concerned, yes, they're given freely at all, you know, government hospitals. That's not a problem, or at a subsidized rate in any case. New drug trials are often promoted by companies, and they do take place in India or abroad. The classic case is the trial for the vaccine, which is going on for COVID-19, which has started in Oxford. The serum for the entire trial is being made by an Indian firm based out of Pune.
Okay.
Did you know that?
I did not know that. Wow.
Yeah, so the Punawalas own this firm, and they're the largest vaccine serum producing firm in the world. So they're making the serum for this vaccine. So you know, so there's a lot happening from India that most Indians don't know about, and it's not as bad. You can't expect, and with the access to internet, of course, the world is at everyone's fingertips. You can't expect to have a look at the services available at Sloan Kettering or the Royal Marsden. It took them a long time to get their act together as well. The only thing is, because they got it together, and because they're not all, you know, they're all looking in the same direction, things work a little better. Plus, it's much easier to manage for 400 people than 1.3 billion.
Yes, absolutely.
You know, it's just Uh,
Perspective.
it is a problem. The population density is in India is one of the chief problems. So I'll answer the first question. It's not that the lack of good decision making is there. It's just you start planning for 600 million people. By the time the plan is made, there are 900 million. Then you revise that plan, there are 1.2 billion. You know, it's just the sheer volumes are humongous. It's very difficult to do that. But I still think they're not doing a bad job.